Okay, let's please rise to salute the flag. Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So good evening and welcome to the December meeting of the Revere Board of Health. My name is Dr. Drew Bunker and I am the chair of the Board of Health. Joining me for tonight's meetings are board members Dr. Craig Costanza, Neza Luadi. Attendance for tonight's meeting are City of Revere staff Lauren Buck, who's Director of Public Health, Michael Wells, who's Director of Municipal Inspections, Health Agent, Paula Sepulveda, who's Board of Health Clerk, Julia Newell, who's Director of Substance Use Disorder and Homeless Initiatives in the SUDI office, and then Claire Enzarello, Policy Writer and Analyst. So first, tonight's agenda, we will review and approve the minutes from October 27th, 2022. And I'm just gonna ask my other board member.
Yeah, I approve the minutes.
I approve.
Excellent, thank you. All right, and next will be the Public Health Communicable Monthly Report with Lauren Buck.
Thank you. So we didn't have a meeting last month, so all of our numbers reflect 2 months worth of data. I'm just going to highlight our influenza number. We had 361 confirmed cases of flu in the last 2 months. This was from October 24th to December 19th. That's a very, very big number, 7 suspect cases as well. This is really not a surprise. We're seeing high flu numbers throughout the country in Massachusetts and in Revere. Just a big reminder that it's not too late to get a flu shot. We give flu shots out at our vaccine clinics that we host every Tuesday from 3 to 6:30. You can see the age range for our influenza numbers ranges huge from 1 month to 92 years, 1 month old to 92 years old. The most at risk for severe side effects or death from influenza are the very young and the very old. So this is just a number that we want to keep our eye on. And we expect that our influenza numbers will stay high throughout the next couple of months, but we'll also be reporting back. For COVID, our monthly COVID report as of December 20th, we had 25,862 confirmed and probable cases of COVID. Our daily average is 14.6. Our 14-day positivity rate is 4.36. And our total deceased is 196. That's it.
Great, thank you. Next is the Inspectional Services Monthly Report with Michael Wells.
Thanks, Dr. Bunker. Same as Lauren, our numbers are combined for November and December, where we didn't have a meeting last month. On the interior housing side of municipal inspections, we had 83 certificates of fitness issued. We had 23 certificate of fitness re-inspections. Interior complaints, we received 43 complaints. Interior complaint re-inspections, out of those 43 complaints, we had 12 re-inspections. We had 1 pool inspection, 2 pool re-inspections. And on the food side, food inspections, we had 40 routine inspections, a little bit low, but November and December are very busy on the renewal side of licenses that expire at the end of the month. We also had 24 re-inspections of food establishments, 5 complaint inspections, 4 re-inspections, and 4 pre-opening inspections. On the exterior sanitation, we had accumulation of litter, garbage, trash, and debris. We had a total of 69 violations issued. Commercial vehicles in residential neighborhoods, we had a total of 5 violations issued. For improper bulky items in placement, we had a total of 71 violations issued. And improper placement of trash and debris, we had a total of 560 issued. Thank you.
Great, thank you. Next is the Emergency Warming Center updates with Julia Newell.
Good evening. Julia Newhall, Director of SED and Homeless Initiatives Office. So This is an emergency warming center pilot that we are piloting in January of 2023 with my office and the Department of Public Health, Health and Human Services. On January 15th through April 1st, the hours of operation will be 7 p.m. to 7 a.m. Our operational lead organization is going to be Housing Families, which is based out of Malden, Massachusetts. Housing Families has operated emergency shelters, permanent housing, and supportive services for homeless and housing insecure families in Malden, Medford, Everett, and Revere, Chelsea, and nearby communities for 36 years. They currently operate 91 units, a family emergency shelter, a 40-bed adult individual shelter, 85 units of permanent supportive housing, and they are a nonprofit organization that operates in the greater Boston area and has been working with Revere to achieve the goal of making the emergency warming center a safe and well-run operation. Housing Families responded to an RFP that was put out by the city of Revere this fall to operate the center. The goal of the warming center is to provide a safe space for this population, the unsheltered homeless population, during the extreme elements of the winter season. We know that exposure deaths occur every year in Massachusetts, and our goal is to prevent this from happening within the city limits. We based our operation off of the model that exists in Malden at the Malden Warming Center. The populations that will be served: Revere has a consistent unsheltered homeless population of about 30 to 40 people. Many of these individuals stay in cars, local encampments throughout the city, or other public places like ATM vestibules, lobbies of businesses, etc. The target population for the center is the unsheltered homeless who do not have a safe and warm place to go during freezing winter temperatures. The center will not serve anyone under the age of 18 years old. The source of funding for this center is ARPA funds. A few important details to share: that the warming center is not a shelter. There are no beds for the recipients to use. This is simply a safe space for people who are unsheltered to stay warm at night and to avoid exposure deaths. City agencies such as the fire department, the police department, elder affairs, building, and health department have been notified about the operation and will continue to be updated with any issues emerge. Operation planning occurred with input from Housing Families, the Revere Public Health Department, my department, and the operations, as I mentioned earlier, are similar to what's currently occurring in the city of Malden, but Everett and Medford are also beginning operations this winter, as is the town of Melrose, or city of Melrose. Happy to take any questions. That's it. Thank you.
Excellent, thank you. All right, the next part of the agenda today will be a public hearing for the regulations on biosafety and the use of regulated biological agents. And we will start with with Claire Enzarello coming up here and speaking.
Good evening, everyone. So tonight I'm here to request that the Revere Board of Health votes to approve the proposed regulations on biosafety and the use of regulated biological agents as the city prepares for life science facilities at Suffolk Downs and elsewhere. It is necessary that we have in place comprehensive regulations governing these developments. All research and manufacturing involving the use of regulated biological agents will be subject not only to these regulations, but also the National Institute of Health Guidelines for Research and the CDC's Biosafety in Microbiological and Biomedical Laboratories Manual. Together, all of these things will aim to safeguard the health and welfare of the citizens of Revere. By voting to pass on these regulations, life science institutions in the city will be required to adhere to strict rules of organism containment, employee sickness monitoring, and proper waste disposal procedures. As we know, the Board of Health shall be allowed to conduct unannounced inspections of the facilities in addition to the minimum of 2 yearly inspections. After my last appearance before the board and in consultation with pertinent department heads, The amount of $500 was decided for permit applications and renewals, as well as for the violation fees. Drafting these regulations has been top priority since I transitioned into my current role in early October, and I just want to take a moment to thank the Department of Public Health, Inspectional Services, and the Mayor's Office for their insight and assistance along the way. As Revere welcomes the exciting arrival of the life sciences industry, I am confident that the regulations before you will ensure safe and transparent practices and procedures. I'm happy to take any questions.
Great, so this is a public hearing, and it looks like no one is here in the audience. Just going to put it out there for the people at home. Yeah, I don't have any questions specifically, just because we went through these regulations in the past, in past meetings, and I felt pretty confident at the time when we went through them and went through the different areas that we were trying to decide upon, that we felt good about that. And just looking through it now, I everything that was on it from last time has been adjusted or is on it, so I feel confident that, you know, everything was done correctly, and I really appreciate all the work you guys put in to do this and make this really a great guidelines and licensing to make this run very smoothly, so thank you. Anything from other board members?
Very good job. Very pleased.
Yeah, I agree. Everything looks fine to me. Very good.
Yeah, so I
Thank
think
you.
we got 3 votes here, all in favor, and to basically sign off on these regulations. So we will do that tonight.
So I'll just say the next steps are, once the regulations are signed, then we will take the regulations and put them into an application that will go on CitizenServe, which is our portal that we use for licensing. And then any organization that comes into the city that will fall under these regulations will have to submit the documentation that is in the regulation to CitizenServe. And then we will start the process, once that happens, of bringing them before the board, so you can find out more about their organization and read through all the materials that they submitted. So that is the next steps after signing. Yeah, and we'll have each person say their vote out loud.
Okay, yep. So I'm going to say my vote is I approve, and we'll sign off on these regulations.
My vote is yes as well.
And yes, I approve as well.
Great. That sounds great. We'll sign off. Anything else for tonight? Excellent. Great. Thank you guys for being here.